So to illustrate that, I thought best that I'll tell you a little bit about my life and my experience. Now, I don't want anybody to think I'm trying to tell you that I was a smart kid and understood this, but I got smart later on. You know, kind of like Mark Twain said that when he was about 14 or 15 that his dad was the dumbest guy he ever met, but when he was 21 he was surprised how smart his father had gotten. And the fact of the matter is I figured it out later on in life. But as one of these street kids running the streets and being a truant and not going to school, I didn't understand. But I was able to reflect back years later and really understand the extraordinary education I received into things that we have defined scientifically today, social determinants of health and so on. So I want to take you on that little journey with me and just tell you a little bit about that and how it figured into me later being Surgeon General and why I chose health literacy as a key component of my portfolio as Surgeon General of the United States. So you've heard a little already, and Michelle was kind enough to give a little bit of my history, which I feel now I have to defend. You know, my parents were immigrants, and they came to this country, and English was a second language for them. My grandmother, Abuelita, brought 27 children, her 27 children to this country many years ago because she said, we're not going to make it where we are. They all became good citizens, mostly poor people working in jobs that nobody else wanted. Laborers, pressing people's clothes, cleaning people's houses, and so on. They paid their taxes, never owned a car, didn't have vacations, and my father was the youngest of 27. My mom was an only child, and she didn't have a dad. And they met, and they married. And I'm the firstborn. I was born on 110th Street in New York City and grew up in Harlem and Washington Heights. I grew up at a time when parents were not responsible for your social activities. You want to play? Go out in the street. We played stickball. If we had a lot of kids, we played a 3-sewer field. If we only had a couple of kids, we played 2 sewers. You only needed a broom handle and a Spalding. I learned to swim in the Harlem River, which is why I'm so healthy today. I've been exposed to every pathogen known to mankind. But every one of those experiences, in retrospect, added tremendous value to my understanding of how complex a world we live in and how important this issue of health literacy is across the board. At 6 years old, we were homeless. I watched my mother suffer the indignities of not wanting to take welfare because her people didn't do that, yet her children were hungry. I understand firsthand why we lose the potential of so many children when they're not worried about education, but they're worried about where their next meal will come from or where they're going to live. And make no mistake, this battle that that's been undergoing the last few weeks, where politicians on both sides now have taken credit heralding all these nice things they did, that scared the hell out of the average person living on the edge, because some of these people, every day, they're not sure if they're going to have a roof over their head. They're not sure if they're going to have a next meal. Those kids may not go to school. So, unlike this perception that we've seen in the press that all of a sudden we were saved, we got another reprieve for about a week. But I will tell you, if this is studied, there's no doubt in my mind that this is going to have severe mental health repercussions on people who live on the margin. And there are a lot of those people who live on the margin, many of whom we have the privilege to work with. So, I learned at an early age that health literacy and cultural competence go hand in hand. They are inextricably tied together. You can't do one without the other. And those are the lessons I learned as a kid from a grandma who really had no education, but I watched her as she cared for immigrants who came in after her on the block. And although she didn't have much, she shared her food. She was a seamstress. She'd make clothes for people. And on Sundays, she would open up her kitchen, and in this little tenement apartment, anybody who was hungry could come and eat. I had so many aunts and uncles that I just called everybody aunt or uncle, or tío or tía in Spanish, because I didn't know who was in my family and who wasn't. But I saw the rudiments of community service, and I didn't realize it, because she felt the social responsibility to take care of others. They all sacrificed so my generation could do well, yet my brothers and my sister and I did not. Fact is that we became truants, we ran the streets, and none of us completed high school. I think we disappointed them a great deal.